is Hong Lee. I'm going to demonstrate centralized dressing change. My hand is free of jewelry. My nail is clean, short, and bare without any polish or artificial nails. My hair is up. I'm in my school attire. I have my school ID. And first, I'm going to start verify the physician order. I gather all my supplies. I'm going to enter the patient room. I'm going to close the door or curtain for privacy, perform hand hygiene. Hi, sir. My name is Hong. I'm going to be your nurse today. Can you verify your full name and date of birth for me? Verify a patient with 2 identifier. Okay, Mr. Smith, today we're going to change your centralized dressing. Is that okay? Okay. First, I'm going to put on my mask. And I'm going to ask the patient if he wants to wear a mask or if he wants to just turn his head away from the procedure site. Mr. Smith is okay with wearing a mask. And what I want to do is I want to put on my mask first before I put on the patient mask, because I don't want to touch the patient and then touch my hair, face, or my ear, and get the patient germ onto myself. And I'm going to ask the people inside the room, or at least within the vicinity of the procedure, to also do the same thing as well. We want to keep the environment asepsis. And then I'm going to perform hand hygiene again, and I'm going to put my clean gloves on. And quickly, I want to palpate the surrounding area of the insertion site for any pain to palpation, or any tenderness, or any fluids. If there are any fluids, we want to look for any sub-Q fluid. And then now I'm going to remove the old dressing with my non-dominant hand. I'm going to stabilize the catheter, and I'm going to pull at the 4 corner, parallel to the skin. And I want to pull away from the catheter side. Away from the, because I don't want to accidentally pull out the catheter. And I'm going to discard the old dressing. And quickly, I want to inspect the catheter site for any redness, swelling, any drainage or discharge. Basically, we want to look for any sign of infection, as well as we also inspecting the surrounding skin area as well. And again, we're going to look for any redness, swelling, or any rashes may have developed. And then going to discard my gloves. I will perform hand hygiene. Open the new catheter kit. Take out the sterile gloves, and I will make sure that I will only touch that 1-inch border. Okay, I will start with the non-dominant hand, and I only touch the inside of the cuff. We'll take out the chlorhexidine and the gauze. And because we're using chlorhexidine, so I will crack it, wait a few seconds for it to saturate the sponge. And because we're using chlorhexidine, I will clean with it using friction in a back and forth motion for 30 seconds. if I was to use alcohol, I will do it in a circular motion inside out, also for 30 seconds. Okay, now I will pick up the tubing and I will make sure to clean it at the same side as the dressing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I will also clean the bottom of the tube and the top of the tube as well. Okay, now we will wait for that to completely dry without fanning or blowing on it. Okay, now it's completely dry. I will take the new dressing and I will carefully put it so that it has a little wrinkle and bubble as possible. Water, trying to get rid of the wrinkle and the bubble as much as possible. For the label, I will label it with my initial, the date, and the time that the dressing will change. And I will place this label at the edge of the dressing. Okay. Then now I will clean my station. Okay. I will take off my mask, take off the patient mask, put the patient in a position of comfort and put the bed in a low and lock position and perform hand hygiene, and I will go document my procedure.